All right, thank you for staying with Daybreak. Keep your views coming at Trevor Mbij at Citizen TV Kenya. Hashtag Daybreak is the state of the nation. We're talking about several issues happening in the country right now. The members of the bicameral parliament are caught between a rock and a hard place, so you to say. There's a bit of a push and pull whether they can even amend or not actually, whether they even have the power to incorporate proposals that were put through by various groups in the public participation section. What we know so far is that they're seeking an extension now. And let me bring in Cherargei on this. Cherargei, what is the problem? And Honorable Duale asked this question and said, why do they want an extension? Is there a problem in the committee?
Thank you, Trevor. What I can say, you know, I'm the former jailer chair, so I wouldn't know much what is happening because the promoters of BBI seems to have hit a snag. But before I just answer that, I want to inform Dr. Mutua, and it is good he's sitting next to Majority Whip of Jubilee, that UDA is formerly PDR, and PDR is a coalition partner of Jubilee. So if he needs the information on that, I am willing to give him off camera so that he can be aware that UDA, who formerly called PDR, is part of the Jubilee coalition. So I don't need to resign to seek re-election. Number two is whether there is, I think what we have been insisting, Trevor, from the word go, as people who believe that the process of BBI should not be an aspect of political competition, political machismo, and us versus them. What we have insisted from the word go has always been, let us have a win-win situation where all issues that are being raised by people who believe that the BBI process should be an all-inclusive process should be gotten. And you had even at the Senate the other day, you had the minority leader, you had also in the National Assembly minority leader, the chair of JLAC did sort, and it is good you have the vice chair of JLAC in the National Assembly, did seek an extension. And some of the contentious issues, maybe I can just mention one, has been on this issue of creation of 70 constituencies. And you didn't hear the chairperson of IEBC saying the creation of 70 constituencies in principle is okay, but the powers of delimitation or review of those constituencies should have been done by the IBC because the Constitution has given them the mandate. Yeah. And those are some of the issues that we have are very sticky. And I think now the promoters of BBI are having what we call infighting, because I think one wing wants the 70 constituencies to remain as is. The other wing wants the IBC to proceed. And some of those challenges that we have been saying, that let us have a win-win situation. We can't just have a BBI process where you are telling people who do not agree with some of the proposals that go and hug a transformer somewhere because you don't agree with us, we must pass this BBI. But I'm happy that there is some realization within the promoters of BBI, including my brother Otiendo Molo, that let us still have a conversation, let us still look at some of the sticky issues, so that let us have a process where all Kenyans can be part of the process. And if you had, I mentioned on the floor of the Senate during extension of time by the jailer, that the process of constitutional review and reform is so sacrosanct and so sacred that we should not be rushed through. We should allow at least every representative put in their voice, put in their idea, so that in as much I know some of the promoters will say that public participation has been done, people had given out the proposals, but Parliament cannot be ceremonial. Parliament must be given its rightful place because we represent the people. We have ideas that we think the issues. But the problem, I can say, just the way somebody has used the issue of NASA, BBI was, or the handshake was built on the quicksand, because you can see there are more other competing interests of political nature than more what will help the ordinary mananchi or the hustler, where we're having a bottom-up approach economy.
All right. And Honorable Tiende, you are the vice chair of JLAC, right? Why is this, why do you even need the time? There's not much you can do about the BBI as it has been presented in Parliament. What is this time for?
First, I have to be very careful what I say here, because this is a matter under active consideration by a committee of Parliament. In fact, we are meeting tomorrow again, from tomorrow. And our standing orders prohibit discussion of matters that are still pending before the committee. But I think I owe it to Kenyans just to explain the broad context. The first point to make is that there is no standoff. Let me assure you there has been no disagreement at all within the joint committee, at all. And there's even no therefore no issue of a difference between the two houses of parliament. In any case, the way parliament works and the committees work is if there was a fundamental difference of opinion, you would end up with a majority report and a minority report, not disagreements, and that alone would not stall anything. Secondly, the position is when we set off to do public participation, we went to do what I would call minimal public participation. And in fact, the speaker only gave us 1 day, so it was advertised for 1 day. But that day when we sat from 9 to 7 p.m., by 7 p.m. there were still 24 groups that wanted to submit. So we had to make a decision. We made a decision to do an extra day of public participation. Again, we sat from 9 to 7 p.m. and there were still more groups. So we ended up doing public participation for 3 full days. We had over 65 organized groups with detailed submissions, most of whom were coming with between 3 and 12 members, almost all of whom were speaking. So we ended up with almost 200 different views in terms of public participation. We owe it to Kenyans to do a thorough job in terms of even analyzing the views that were given, because those views can't be in vain. Thirdly, for that reason, because of the detail in terms of number, in terms of the detail of submissions, and in terms of some of the issues raised, we sought an extension of the speaker of only 14 days. The speaker gave us 10 days. It's no big deal. I think we will finish in that time. Now, a number of issues arose, and I will not talk about the merit. I'll just talk about in terms of how they arose. I will not give my view on any of them. One of the interesting views that arose was in terms of the role of parliament. Okay? Recognizing that under Article 257, Parliament must still vote on this, and it fails or passes by simple majority, and thereafter it goes to referendum. And the question is, what is the role of Parliament? There are those who said that Parliament has a role, especially if you realize that there are some typos, like the word Kenya is written as Kenya. You can correct that. And we got those views interesting from some fairly learned people without changing the substance. Then there are those who came and told us that, look, the reason why Parliament has a role is because a popular initiative can even be unconstitutional. Somebody can come and propose that the presidency of this country henceforth will only be held by 2 tribes. And if it passes through the counties and it comes to Parliament, can Parliament simply say it is salutary and take it to referendum when it might actually pass in that referendum? That therefore Parliament has a minimal role to consider the constitutionality, okay? And that Parliament can also just look at it, and if, for example, there are typos, you can work on it without changing the intention of the promoters. Now, that's one view.
Yeah.
The second issue is in terms of the weight of submission. We got rather unexpected submission from some important state institutions. The Kenya Law Reform Commission came to us and confirmed that they were part of the drafting team. And in their view, whether I agree with it or not is not the here and there. In their view, Parliament can change the document. Now, you know, that's very fundamental. In the first place, they said Parliament could change parts of the document as long as it does not fundamentally alter the intention of the promoters. On the other, they said the Parliament could, at the very least, change the typos and errors. The IEBC then came to us and told us that in their opinion, while it is okay for politicians and politics and popular initiative to determine by what number constituencies can be increased, the delineation of those constituencies must still come to them. And they made a long legal argument in terms of the Constitution and thereafter. Yeah. The Kenya National Bureau of Statistics came to us and confirmed to us that to date, they do not have official records of the populations per constituency. Now, you know, delineation of constituencies must depend on the population per constituency, among others. And then they said that they didn't engage with the other team. You know, those are very fundamental.
We did a census.
So we'll come to that. The census, they delineated census along the administrative boundaries, like, you know, the county, you know, like sub-district, like location, but not along the electoral boundaries.
It's
ward.
It's a matter of math.
Yes, like the ward and like the the constituencies. And you must know, the administrative boundaries and the electoral boundaries are not coextensive. Yeah. There are some counties where you find, it cuts across. Anyway, so those are fundamental. Then thirdly is the question of some practical questions. When IBC comes and tells us that, as a matter of fact, when the new constituencies are delineated, they cannot delineate them within 6 months, that they need at least 2 years, as a matter of fact, that they've tried all permutations. And then they tell us that we must also understand that when they delineate the constituencies, they will have to delineate the wards. And that is also another extra work that requires more time, so that they tell us that no matter what view they have, it is impossible. That is something that must be given some weight. Then there's the question of what we call severability. Yeah. There are those who came and submitted to us that, contrary to popular opinion, that document may not need to go to referendum as a document. That if Parliament were to pass it, both houses of Parliament, then we can remove the parts that don't require referendum, and it's taken to the President to sign into law. And the parts that require referendum may then have to go, for the referendum. Yeah. I mean, those are fundamental issues. Then there's the question of litigation, which we must consider. Yeah. We had to invite the lawyers. As we speak now, there are 7 cases that are active. They are consolidated, but they are active before the High Court, raising several issues. Most of those issues, almost all those issues, are legal issues. As the Joint Legal Committee, it behoves us to consider some of those things without getting to the jurisdiction of the court. But more importantly, to consider, because inevitably there will be litigation after this, whether the referendum passes or not, to consider what are some of those possible areas of litigation and what answer do we give to them in advance. We, as a team of lawyers, and that committee has many lawyers. The Joint Committee has almost 16 lawyers. You cannot just do a salutary gesture and take the document as presented and take it back, because then why was it given to us? Yeah. It could as well have been passed in the, without being given. But because it's the first time that we are having an amendment by popular initiative, it behoves us to answer some of these questions, not just for now, but even for the future. Now, that is why we needed time. It is not because there's disagreement. There can be disagreement. Lawyers disagree all the time. But the beauty is, it's never disagreement that derails anything. It is a difference of opinion. But so far, we don't have any.
Will this document change? You've said fundamentally so many times.
I have said that that's one of the questions to be answered. Can it change? And it's one of the questions that were framed.
So it might change.
I don't know. I am not giving you any answer. I told you I'm not giving you any answer today. I'm just framing the issues.
Okay, but thank you. What do you make of the argument that has been given by the Vice Chair of JLAC? This has to be very clear.
Trevor, one thing that we have to agree, and I have a lot of respect, tremendous respect for the team of lawyers who are in Parliament. And by the way, they are lawyers of high standing in the country, and they have, stellar careers. Lawyers like Otende Amolo, there are people who've done many things that are,
He's about to attack them.
Let me make my views, because that's a fact. That indeed, that's who they are. However, Trevor, all the time if you sit among his lawyers, and you know that as a matter of fact, and you have witnessed that during matters being contested in courts of law, from the constitutional issues we've had in our courts of law to the presidential election disputes, you've seen how lawyers can argue their cases, and in many courts, it's been quoted even historically. They would even get to the extent of arguing whether an angel can dance on the head of a pin, and that becomes a major argument, And so what you'd expect, and what literally happen, in my view, when they sit to look at an issue, is there will be views and contra views and other views. And that question of persuasion is continuous when you talk about, a discussion among his lawyers. Now, the question is this, now that they have the document, and this is, I think, where they have to broaden their thinking and seek more and lean more towards having a consensus that will take the process forward than breaking in between and reading between the lines and interpreting and applying so many of the principles of law. Because if you get to then the fine arguments, the arguments would continue forever. Yeah. But maybe some of the broader highlights I would bring out is this, for example. And I want to be on record as saying, because I was there during the first discussions. Yeah. There was a major debate first in whether the two committees should invite public views, public participation. That first started as a big debate. Yeah. Should they open that window? And the basis of that argument was this, Trevor, and our viewers who are following. The argument was in the formulation of the bill itself, before it was advanced to the people, wasn't the informant and the content of that bill supposed to be the public views first, or during that first process, so that the content of the bill itself is supposed to have been simply based on the views that have been collected. And remember, there was this process that went on for a long time from the team. And then the other question would be, and was, all the people who would be coming to give views at parliamentary level, weren't they accorded the opportunity to come and give their views at that time, such that their content would be there? And if somebody comes in now and they gave views at that time, would they have given views that informed the content of that document? And then maybe they may come and give different views depending on the time and weather and what. Yeah. And that became a big discussion. But because of what Otiende Amolo has said now, as the process that is supposed to be undertaken by Parliament, for the adherence to that process, then it was decided that it is good for them to satisfy the process by holding public participation. So this is where most of the major questions will arise, in my view, Trevor. What are they going to do with those views? And I think that's the most important. At the end of the day, once they have been collected and people have been listened to, and they still have a document that they're holding, that still they have not decided whether they can amend or not amend. Where do they take those views? And I think those are some of the big questions that they will have to be answering. Okay. I have personally no problem in them seeking an extension of time. There's nothing wrong in extending time for them to discuss, debate, and so on. But they may have to walk that fine line very carefully, because then supposing they collect all those views and then at one point or the other they can do nothing with those views, wouldn't that even add more weight to the basket of anyone who wants to challenge the process then? To say then that we were called, we gave views, and after those, the views have just been trashed and thrown away. So at the end of the day, you see, Kenyans have spoken. And they spoke when this process traveled the entire journey, from all those public meetings that were held, in the rallies and the documents that were presented and so on, and finally through the county assemblies, through the representatives there. I believe that Kenyans were still seeking to speak through Parliament, for that matter. And I hold the same views that indeed Parliament cannot act in vain. All right. But I think at this point it will be important for the entire team to make a decision that they would be more driven towards finding a solution and not extrapolating and trying to break in the bits of whatever is the content and whatever has been brought to open up another new process, but then deliver on a final product driven by what is in the content and in the best interest of the country.
Governor? Let's be practical. I think my two gentlemen and our good Senator Charangai have just been skirting the issue. The issue is down to this. I usually don't agree very much with William Ruto, but on this I agree with him, and that is that we need to have something that has a sense of consensus. Now, Otiende Amolo has presented very good points about arguments that were brought in. And the constitutionality of this document is critical. We don't want to have a document that will now need interpretation all the time in the court of law.
Yeah.
One of the things that I like about the American system is the American system, they keep things simple. There's a movie called Philadelphia. One lawyer tells another one, tells a witness, tell it to me as if I was a 6-year-old. There are very many things in this bill that can be tweaked slightly so they do not need interpretation. So they are very clear. So people don't start thinking what was made to do. And then we have to ask ourselves, who is this document for? It's for the people of Kenya. And what will be the problem with a few changes, a few tweaks here and there to make it better for us? Because we don't want to go into a referendum all the time, you know? But we tend to be very legalistic in this country, tend to be very, how do you say it, bureaucratic. There's an example I've given here before of a swimming pool, whereby you go to a pool and you find a sign that says, do not enter this pool unless first you've taken a shower and 2, you've put on the right swimming gear. And as you walk by, a child slips, a 2-year-old, aingia ndani ya pool, aanze kunywa maji. So the Kenyan system would tell you first to go and take a shower, go look for a swimming costume, and then come and jump into the pool and save the kid. The kid will have died. If you jump in immediately, they say, hapana, umevunja sheria, you know, and save the kid. The kid will be dead and will have followed the law. So we need to make sure that people understand that at times this is a period, and I like what Molo said, that this is new. There are arguments that have been brought forth, and we need to open our minds to the reality that we may need to open it up, because we always say that you cannot be clean.
Yeah.
If you want to get a shower, you have to agree to get wet.
Okay. Because
lazima maji tumiwe for you to be able to get wet and take a shower, to be clean, so that you can be able to provide the services. And lastly, let us not get into this point where people say it cannot be changed.
Yeah.
You know, you remember that cry that was in Parliament, you know, let us not be vague, let us go to The Hague, and what that brought us in this country. Let us not be a country whereby we are not open to new ideas. These laws are formed by us. These principles are set by us for the goodness. So as I am for Parliament doing its duty. Okay. Let's have a constitutional positive document that will not bring any problems. Let us clarify a few things and let us take it to the voters. Okay. But let us not just hold public participations for nothing. All right. Listen to the lawyers and others and make this a better country for all of us.
All right. Cherargei, I want to hear your views on this BBI issue, and then we talk about the issue of ICUs that are full and vaccines. Many other things are going on in this country that are critical that we talk about, but I want to hear your views on the argument that has been put forth by Dr. Tiende Amolo on why there's a bit of a delay.
I think, Trevor, that is what we have been saying all along, that this process should give an outcome of win-win situation. And we have said that this process should be devoid of political competition or any form of succession politics. And I agree with my panelists that all these issues that have been raised, and Parliament should not act in vain. And the Vice Chair of JLAC has put it very well in a concise manner, that all these issues that have been raised are so critical and so fundamental that there is need to some extension. And I did support, even when the JLAC chair in the Senate did request that they give an extension of time, because I believe when all these issues have been sorted, it is for the benefit of Kenyans. It will not benefit me or my colleagues in the studio or you yourself. It will benefit for 7.5 million Kenyans. And I think the reforms that we want to see in the Constitution is to improve, not for self-survival of self-preservation of individuals who want to hang on power. And this critical issue should not be wished away. Parliament is a representative of the people. Any issue, and that is why many people would argue that the process of Parliament is ceremonial. There was already public participation. The MCAs had passed the process. Article 257 says you introduce to Parliament. But I want to agree with critical observation or comment that has been made by senior counsel that all these issues that have been raised, if some of them are agreeable, and that has been our argument, there is no need to take them to a contested referendum. We can still have an uncontested referendum where issues Parliament has agreed with, it is processed, the President is given to assent into law, and it takes effect immediately. Others that are issues here and there, we can move it to referendum. and have uncontested referendum where all these issues have been agreed with, where it needs a referendum or through popular initiative. And I think I agree largely with what, and if that is the thinking of the committee, because our brother has refused to give his opinion, I understand, because he's part of the committee and therefore he can't give a position of the committee. He must allow the committee to give its position, and I agree. Is that some of these issues will be sieved through, they should think through. If Parliament can agree with some of these issues and Kenyans agree with it, we give the president to assent to. Then if there are issues that we think they should go to referendum, then we can allow. Therefore, it comes to our argument, and even the argument of the deputy president, that this constitutional process, we can have a win-win outcome. And I think every Kenyan will be happy, because we don't want a narrative of us versus them. You remember there was even by the promoters of BBI that if you are uncomfortable with this document, it was like holding a gun on our heads, that if you do not agree with some of the proposals, can you oppose? There was a lot of noise in the country. If you don't agree with it, just go to no side, campaign against the document. But I'm happy that the leadership of Parliament and jailer committees of the two houses have realized that it is much more important to have a document that unifies the country, to have a document that looks into the posterity, to have a document there we are having a win-win outcome. And I'm happy that everybody is seeing this. And I can say finally, Trevor, that this document is not cast on stone. We can still review. I know Senator Wamatangi is uncomfortable because of one aspect there of 70 constituencies, and that is why insisting that this document should go as it is, because we don't need to close our minds and say this is cast on stone. Even if it is about reopening the issue of 70 constituencies, and we agree and allow the IEBC to do, so be it, but let us wait the outcome of the Committee of JLAC. Please, and I want to urge through the Vice Chair who is sitting next to you, that make this country proud, make Parliament proud, come up with a document that will be acceptable by all Kenyans.
All right.
Before we leave this subject, I'm glad Senator Cheregai agrees with me. We may be reaching the same destination, but through different routes. I have not said, and I have never ascribed to this win-win referendum, and I don't need to reopen that debate, because there can be no such thing. By definition, a referendum is contested. It's like an election. It is actually an election. Secondly, I think it is important to understand that the distinction between what the views, as I've summarized them, are, and the views of Senator Cheregai and others, is theirs is substantive, that you can go and reopen some of the substance. But the views so far as summarized is technical. The thinking there, even by those who submitted, is not that you can now go and supplant your own views to supplant the views of the promoters, because that would be unconstitutional. But this is a technical aspect. The second thing I want to explain is, even some of us, and even my own contributions initially when the bill was being committed to the Joint Committee, was that as Parliament, our role should be really quick and salutary. But once I realized that even the courts take this issue of public participation subsequent to the draft seriously, then I realized why even Parliament must take it much more seriously. You know that, for example, the passage of the bill by Tana River was nullified, I think, by Justice Nyakundi, on account that they did not do public participation, despite the public participation at inception, at every other stage. And so we, even in Parliament, don't want to have a situation where a good document then suffers nullification because someone says Parliament did not do public participation. Lastly, and Senator Matangi asked an important question, and that is a question out there for us to answer. So what do you do with those views? Well, depending on the answers that the committee gives, what you do with them can be light, it can be fundamental. But even if it was nothing else, at least you'd have a good report that anyone can refer to, because eventually, even if the document goes to the public for voting as it is, it might actually instruct how one votes. Can you imagine, Senator Matangi, what would happen if today, say, the two houses of Parliament unanimously reject the document? That already influences the vote, the thinking of Kenyans in terms of how they would vote.
Right.
also when they unanimously endorse it, that also influences the thinking of Kenyans. So what Parliament does can be quite instructive, even if it did not have to change anything.
Right. Maybe just a quick one, Trevor.
Very brief. Let's talk about the ICU and COVID-19.
On some of, just wanted to clear the air and the mind of Senator Cherargei that I'm not uncomfortable at all, because he says that I'm uncomfortable because of the issue of the 70 sub-counties. And Senator Cherargei, you know that for all our history with you in the Senate, I've never been unclear on my stand on the question of one man, one vote, 1 shilling. And on the question that there has been unfair, unequal, and an uneven representation that has seen most of the people from my area in Mount Kenya region very, very, very shortchanged on the question of how resources are shared based on the number of people that are in our counties, in our sub-counties, and how they are represented. Yeah. I've never been ambiguous or vague or anxious about it. I've been clear that indeed that is something that must be resolved. Senator Cherargei, you know, we have been on this journey with you, even in the committee. Yeah. And we decided, Trevor, that the only way you can have equity and equality and adhere to our constitution is to address the question of that matter of representation. And the way to do so is to ensure that constituencies have got at least a fairly equal number of people who are represented. And because that is how our resources are shared nationally, then you have people receiving the resources that are due to them fairly. And so the fact that Kiambu right now has got more than 3.1 million Kenyans is a matter of concern that must be spoken about. The fact that indeed there are more than 12 million Kenyans actually heading towards 14 million now in the area of Mount Kenya. That's a matter to be discussed. And so we are happy that if this bill goes through, then that matter will be resolved and people can be represented in a more equal way, and resources can be shared properly. It's not a matter of anxiety, it's a matter of fairness and right.
Governor, let's now talk about the issue of ICU beds and COVID-19. Those are the pertinent issues facing the nation today. You have gone on Twitter several times saying, Nikubaya, your 15 ICU beds are full. It's amongst the highest number in the country, if I'm not wrong, give or take. But what happened to your other governors? Did you guys as governors fail Kenyans? We saw that there were monies allocated, or you only have 15 ICU beds. What happened to the other governors? I mean, there's no... How come they didn't manage to get more beds? What really happened there?
Well, I think it's important to realize, let me give you a small background. I don't like speaking for long, but I'll just, excuse me for this, because one needs to understand where we're coming from. For many years, this country's healthcare system has been in a shambles. And this is because it was neglected. Let me give you examples. When I got into Machakos myself, I could smell the maternity from about 150, 200 meters away. That's how dirty the hospitals were under the national government. And when I got into my Machakos, I found 2 to 3 people sleeping on the same bed. You've got a pregnant woman here, you've got somebody with a funny disease on the leg, and another one with a coughing chest disease. Unrelated diseases, sleeping on the same bed. And that was the state of our healthcare across the country. With devolution, we were given an opportunity to fix things. For example, I cleaned up the hospital. Nobody sleeps 2 to a bed. I made sure it's cleaned, repainted. I got things working. There are no ambulances. People are being carried with mkokoteni. You know, I bought ambulances for every administrative location. We have improved healthcare in this country through devolution. The president came in with the equipment that he gave us. So now we have got kidney dialysis basically in every county in this country, state-of-the-art theaters.
Others are not working.
We're able to improve. Well, that's a problem of management of those individual counties. But where it has worked, like in Machakos, we're able to do a lot. When I got into Machakos now talking about ICUs, we had 0. We did not have any ICU, we did not have any HDU. For 1.5 million people, nothing. You need an ICU, you are shipped to Nairobi, to Kenyatta Hospital. No ICUs. Within a very short time, I had 6. Now, the challenge is not that you need many ICU beds. That's why people don't get it. Because very few people make it to the ICU. Most of the time with my 6 beds, we are finding that on average, 2 are occupied every 2 weeks or 3 occupied every 3 weeks. And you find that most of the time, you find the ICU had nobody there because you treat people at the lower level. Nobody was making to ICU. Maybe when you had a bad accident and many people injured, you had the ICU beds filling up, but hardly. An ICU bed is not just a bed. It's a bed that has all the requisite equipment. But
like
more important, the most important equipment or the most important resource for an ICU is the personnel. Because nationally, internationally, you need 1 nurse taking care of 1 ICU bed. At most, 1 nurse taking care of 2 ICU beds, monitoring 24/7 this patient all the time. A small blip, you are right there. But in this country, we don't have enough personnel, we don't have enough money to pay our health workers. So we could have 5,000 ICU beds, they would not be functioning because we have to have the personnel to take care of them. They are gadgets that have to be operated. They are tubes that have to be fed that need anesthetists. In this country, the ones qualified are only about 70, 75 for entire 50 million people in this country. So you can have many, many ICU beds, but they will not be used. So when we are talking about ICUs, it's not that people have not invested. We have invested. I have invested. From 6, I have 15 ICU beds in Machakos level 5. I have other 8 ICU beds. I have HDU beds. I have a total of right now 45 comfortably beds that are being fed with oxygen that can keep people alive in Machakos from 0.
Do you have the personnel
from 0.
to go?
Now that's a challenge. I have personnel. My doctors, my nurses are tripping over themselves. But I am luckier than other counties because when I got in, because healthcare is a big part of my governance, I hired an extra 800 nurses. I hired more doctors. I'm hiring more doctors as we speak because I need them. I have trained more nurses in ICU than the other counties because that's a priority. But it is a challenge because the resources are not there that are budgeted under healthcare. And you cannot budget everything under healthcare because you can't put all the money in healthcare. Well, you need to provide water, you need to provide roads, you need to provide education and other services that keep you alive, not only taking care of you when you fall sick.
So from the Council of Governors, what then is the challenge right now? Is it resources that you don't have? Is it personnel, or is it just pure mismanagement?
No, I think the challenge we have right now is the reality on the ground. And Barack Obama came out clearly and said that the problem with COVID-19 is that it overwhelms the health sector. With my 25 ICU beds and others and 42 HDU beds all combined, 45 rather, and now we've got 10, several more coming up by the end of today. We'll have 60, 62 oxygen points. Under normal circumstances, they are more than enough. But with COVID, they overwhelm. Look at what happened in New York. Look at what happened in Los Angeles. In LA now, it got to a point whereby they would pick you up at the hospital, at your house, you are dying, and the ambulance operator, the ambulance nurses would have to decide whether to take you to hospital or not. If they think you will not make it, they don't want you to go and take space of somebody who can make it, so they let you die because of overwhelming the system. Yeah. So what is happening with COVID is not that the governors have not built ICUs. Every county has ICUs. Yes, some do not function for whatever reason. Others have challenges of health, but under normal circumstances, everything would be kosher. Maybe it can be better, it would be okay. The problem is COVID will overwhelm the system. That is why prevention is always better than cure.
All right. Cherargei, you as senators were supposed to be conducting oversight over counties, and now Kenyans are saying that you have also failed them in one way or another.
We have not failed because you remember, Senate, the former special ad hoc committee that was chaired by Nairobi Senator and later chaired by Senator Sylvia Kasanga. And I remember you did host us in one of your shows. And I'm happy that the governor has said something about the preparedness of Machakos County. But you know now what shocks is that there was a special audit of Auditor General on the use of COVID funds. And that special audit was a recommendation of the Senate committee ad hoc committee that we recommended that the usage of COVID funds be audited under special audit that was released a few weeks ago. And therefore, it has shown that most counties did not use the COVID funds as provided for, even the donations, even the money from the exchequer, and many other corporate and many other donations. So as a Senate, we have played our role. The recommendation we made was on the special audit. It was done. And if you look at most of the counties, and I don't want to mention names, for example, let me use Nandi County because I am familiar with it. Some of the recommendations by the Auditor General has been transmitted to the DCI and EACC to do further investigations on some of the usage of this money. So as a Senate, we have done our part. The Auditor General have done our part because it is our Senate who directed special audit on the usage of COVID funds. But it is shocking, and I want the Council of Governors to take this seriously, that most of the KEMSA supplies and most of the money that was released by the Exchequer and most of the money that was released by donors and many other wills of never made the intended use in many counties. That's why most of the counties are not prepared because I remember, Trevor, at some point the president and the government was saying that counties had enough isolation centers, they had enough beds, they had enough ICU. I know the aspect of COVID will always overrun the public health care system, but you reach in the first wave. Most of the counties and even the Council of Governors and the county governments were telling us, and they were confident that they have enough isolation centers, yet they didn't tell the country that the isolation centers they were claiming was schools or public utilities. So as a Senate, we have played our role, and you remember even yesterday, and my leader can confirm there, that as a Senate, we are even making sure that the Health Committee becomes more proactive so that they can be giving country timely updates on what is really happening on the issue of COVID. Finally, Trevor, you know, it's also shocking that the president then, towards the end of last year, had given 20 days to DCI and EACC to investigate the misuse and abuse of KEMSA funds. And you remember there was a famous, what we call KEMSA haste, where many senior people were being accused of being complacent of either corruption in KEMSA. And I think in as much as we agree that third wave is very serious, no one has resolved where the president gave out 20 days to DCI and EACC to investigate individuals who are being accused because the same individuals did steal the KEMSA funds that was meant to assist Machakos County, for example, to get extra ICU beds, that was meant to assist the Machakos County government to get extra ventilators, to get oxygen points, to assist in sanitizers, to assist in masks and many other issues, PPEs that are being used at the lowest. And Trevor, it is so sad that most of the medical personnel that were supposed to be given risk allowances, to be paid through universal health care, to be given the frontline risk allowance that were being given. Up to now, Trevor, most counties and most government institutions, medical centers have not paid that amount, and therefore you find most of the medical practitioners are now panicky. They are not even having the confidence. And finally, out of 1.2 million vaccines that have been shipped in the country, it is so sad that only 40,000 Kenyans have gotten vaccinated. And I think as a country, when the rollout of vaccine, I've seen, you had mentioned something about the Russian vaccine that was approved by the Poisons Board. It's supposed to be rolled out in somewhere in, is it Nanyuki or Nyahururu? And we have AstraZeneca vaccine that is ongoing. I think the uptake of vaccine, there is a lot of most Kenyans are skeptical that they are not willing. But we would have expected the president, we would have expected other political leaders to be vaccinated where we can see them, where media is there, so that all Kenyans can have confidence. And I want to challenge my colleagues in the studio that they must take this vaccine so that they, and I commend Governor Mutua because he has already taken a vaccine. I saw his photos online. And I think that is the inspiration that we need to give Kenyans so that they can take this vaccine. Okay.
Well, Matangi, you know, I'm bearing on this because Senate and governors are almost the same, not the same level, really, but they're supposed to conduct oversight.
That's right.
Yeah.
Now, you see, Trevor, we have to agree that where we started from a dip in this sense that at no one time, all the time, way before devolution, was healthcare ever taken seriously? I mean, the application of policy, sense, mind, and resources towards making healthcare a top priority of the country was never there in the first place. That's why the stories that were told all the way before were people dying at the casualty at Kenyatta Hospital all the time. And people were being transported from Mandera to all over, to Nairobi for basic healthcare issues. And then that is where we started from upon devolution. Yeah. Unfortunately, the first lot of governors who got onto the driving seats of their counties came up with the same mentality in those positions. And they continued with the same style of leadership, whereby elections and continuing to sit on those positions is based on the amount of propaganda you can take around, the deceit, and how much you can be able to buy people, and so on. And the rule of the day was how much can you be able to amass to be able to win your next general election. That is how, that's what happened to most of the counties. And then from there, then TAP all of a sudden being jolted to attention by COVID. And so you have to find yourself and get up from there and start getting to do things so that you can address that situation, both nationally and at county government level. And so then you ask yourself, Trevor, when we have to face the kind of situation we are facing, and I want us to draw very clear distinctions, Trevor, here, when we speak and compare healthcare standards locally and what we are doing and outside there. Let me tell you, if you go to any of those countries outside, outside the first world countries, and you see the kind of treatment you get for what you would call ourselves basic ailments, they take everything so seriously. You go with a complaint to a hospital, they'll look at you, examine you to the last bit of your organs. Yeah. And so when you hear that people have been admitted and they're full in Italy, they're full wherever in other countries, it's because they go to detail. And that's why you find that they'll be overwhelmed. When you talk about being overwhelmed in the US and in the UK and other places, that's a completely different scenario from what we have here in Kenya. I mean, here, you'll be taken... Trevor, did you watch the other day some video? And I don't want to go into its detail, but you watched a video the other day where a young man was complaining bitterly, his father dying in an ambulance outside the hospital here, asking where, and the mother was wailing. Yeah. And that is the attitude that we have had towards healthcare in this country. That human life is just something you can pass on and pass by. And I know I've been to Governor Mutua's county, and when they were launching the equipment, the MES equipment, and I can attest to the fact that he has done quite a lot, in getting it better. Of course, there's always room for improvement. He can do better than he did.
Okay. Senator, I'll come to you in just a bit. I have some technical challenges with your microphone. I'll be back in just a short while. But Dr. Tiende, what is the way forward on this issue? There are several issues here. There's the issue of the ICU beds being overwhelmed. There's the issue of COVID-19 right now. There's the issue even of Russian vaccine row now raising safety concerns, where the ministry says the people were saying that they have the vaccine here. The licenses are not out yet.
There are three broad issues I'll speak to. First is the issue of the vaccine. And let me disclose that I also took the vaccination 2 days ago in Parliament, and I saw some people telling me I had jumped the queue. I had not jumped the queue because, as I said here some weeks back, I thought that priority must be given to the healthcare workers, to like teachers and other people in the front line. And then people like us would come somewhere in the fourth or so tier. Yeah. And I think right now we are around in that tier because this vaccination was arranged for us through Parliament. And I think even the judiciary has arranged. And now I've also seen they've also arranged for a number of state institutions and parastatals. I think that's like the fourth or fifth tier. And I really want to encourage Kenyans not to fall for this, propaganda. Seeing the ravaging effects of this COVID, you are much better off taking the vaccine. Not so that, as I understand it, not so that you cannot get it, but so that the debilitating effects can be milder. And that might just save your life. But having said that, I want to call out the Pharmacy and Poisons Board. I think they are not doing a good job. in terms of the policy of, approval of which vaccine to bring and the clarity. When you see that now the Sputnik, vaccine has apparently been approved and already somewhere in Nanyuki, and someone was offering that you can take it at, 8,000, then the Pharmacy and Poisons Board comes in and says, no, we didn't approve. We approved it for importation, but not for use. Even the idea of approving for importation, why is that not out there in the public? Why have they not come out to tell us, in their own opinion, which vaccines can be imported? And if they can be imported, why can it not be out there so that everyone knows? When you see, like, appears on page 10, an official saying that although they approved it for importation, it is not for use because they are still developing guidelines. How do you allow something like that? It is not right. The third thing about the vaccine is the structure of distribution. The government has done well in many things, but in terms of structure of distribution, it is totally unclear. I don't think anyone can tell you with clarity what that model is. All we know is that once the vaccine came, some were sent to the counties, and I think it was left to the wisdom of each individual governor how to apply it. And even what remained in national government, it's not clear the distribution structure. And it is also not, the government has not fought this propaganda sufficiently, because there's so much propaganda around the vaccine. And as I close there, I think that on this issue of COVID, this third wave has become so serious that I honestly believe that the government must implement the lockdown again, especially looking at the figures around Kajiado, Machakos, Nairobi, Kiambu. I think that if we are to save our people, we must go back to that lockdown. Otherwise, we are going, the numbers that die daily, the numbers, yesterday alone I saw the figures, it was about 1,500 and over testing positive. Yeah. Those are astronomical numbers. For the last 7 days, we are oscillating between 18 and 28 people dying daily. That is too much. Okay. The second issue is about the issue of health. We've had this discussion before. Yeah. I maintain, and we can discuss it to high heavens, health as health was never devolved. But a policy decision was made to devolve health by this administration in its first regime. And that has resulted in a mixed bag. There are counties that have done very well with devolved health, actually better than national government could have done. I visited Governor Mutua when I was still ombudsman, and I know the efforts he made. But there are counties that have done much worse than the national government could have done, because there are varying areas of interest. There are governors who see, and you know, the sectors with money is usually like health, education, they're just about 3 or so. So there are governors who see that money as money for campaign and other things, not as money for saving lives. And therefore they put it to other use that is not accountable. In this COVID time alone, forget about KEMSA. And KEMSA, I have said, KEMSA is a theater of the absurd that really just increases the level of irritation of Kenyans. So much has been stolen, and then every day you are treated to a theater of those who stole it and nothing is done. I mean, it just increases the annoyance. But even in the COVID times alone, in the counties, I think 28 counties have been singled out for also misusing the COVID monies. So the idea of health, we will have to really examine this, because there are good aspects that came with devolution of health, but there are also bad aspects. And that brings me to the ICUs. Yeah. You see, investing in public health institutions has never been a priority. It was not a priority previously. Right now, it's a priority in some counties, but not in all. In those counties in which it's not a priority, their last imagination is that thing of ICU bed. When Senator Cheregei says there was an analysis done, I think at the beginning of COVID, where they were talking about COVID preparedness, and they had said like 41 counties were ready. And some of those counties, when then the journalists went to cover what was there, you know, an empty room with a seat is called a COVID prepared ICU, you know. It goes to the fact that we've never really invested in public health institutions, but especially in the ICUs. But part of the reason is, you know, when the first wave came and the second wave, incidentally, it was coming and it was mild, and even those who were passing on and the numbers were relatively low, somehow they did not seem to need ICUs like we now need in this third wave. It is this third wave that has now woken up to the reality. And I think with all the ICU beds full in Nairobi and elsewhere, there must be a conscious effort to partner with the counties and have some ICU beds that are ready in the counties.
All right. Gentlemen,
can I just...
very briefly, because I've run out of time completely,
yes,
Governor. Just 10 seconds.
I just want to say that it is very important what has been spoken about COVID. And that is, I remember in Machakos, I built a mobile hospital in a stadium. And I was going to pull it down sometime in December when the infection rate was about 2%, 1%. And Mutai Kagwe told me, don't do it, the minister. And I'm glad I did not. Because now we are seeing more patients coming into that hospital and close to nearly 600 isolation wards that we didn't pull down. Healthcare was devolved because healthcare should be dealt with at the root. People should not sit in Nairobi deciding. You remember now, for example, because I control how healthcare is given in Machakos, I even put up a Machakos Cancer Center. People don't have, my people of Machakos or the region don't have to come to Nairobi for chemotherapy. And to even make it better, I have universal healthcare in Machakos. I've decided that nobody pays anything. You can come there for cancer treatment worth 10 million shillings. You can sleep in hospital and get operated on and your bill. You'd pay nothing because I believe that as a government, you can be able to pay for that. Now, when it comes to vaccination, finally, I met an Italian man the other day who told me he can't believe what Kenyans are talking about, that you don't want to take the vaccine. In some of these European nations, you either take the vaccine or you're seen as a murderer. Because if you're not taking the vaccine, you'll become a carrier who kills somebody's dad or somebody's uncle. You know what I mean? So it is important for Kenyans to realize that this vaccine is critical. Right now, they're talking about 50% of people in Nairobi, more or less when they say 50% infection rate. That means 5 out of every 10 people in Nairobi basically has been exposed to COVID. And as we said, more people are going to ICUs. Today, as you know, we have a memorial of Robin Jogu. I want to recognize him, a good friend of ours who worked in this station. And he was healthy. I had lunch with him just a few weeks before he was hospitalized. And COVID took him. He was a healthy gentleman. And COVID now is claiming a lot of our people. And so that is why I agree with senior counsel that we may need to tighten the belt and say prevention is always better than the cure.
But I need 10 seconds.
Actually, I need less. Because you know, you have perfected this art of making my contribution an anti-climax.
Yes, take it 10.
Because when I'm about to fire up, then you say that my sound system has a problem. Anyway, I think, Trevor, I just want to put it on record that it is important that we absolutely and completely make a turnaround in our approach and attitude towards healthcare of the general masses in this country. If we don't change that, then this is going to be continuous. We are dealing with a situation that may last longer than we expect. And I've said this before here, Trevor, we still have HIV, AIDS around, a virus that struck us in the 80s, still there with us. How are we going to deal with corona if this is how we've dealt with it from the word go? So I think we need to make a complete change, invest in our healthcare as though it matters and the lives of Kenyans actually do matter. That's important. Because I had said I was going to be leaving by 8 a.m., so I want to be very disciplined and say that my final comment is to thank you for inviting us here, wish Kenyans a very good day, a healthy week, and observe COVID protocols. This thing is terrible. We have to deal with it.
Thank you so much. At least that is a climax, right?
Well, let's try that next week. Let's try that next week.
All right, thank you so much for staying with Daybreak. And now leave you with Jeff Koinange live. There's an interview with Michael Joseph, but that is coming up right after the break. However, we can read the feedback if you still have the time for that. Let's bring it up if we can, really fast. Let's see what you're saying. Bring them up closer. Flavian Mulama, it has been overstated that Parliament can't add or remove even a comma. The extension of time just speaks to some of the unconstitutional provisions being fronted by BBI, the issue of boundaries and judiciary ombudsman. Let's see what else you're saying. Engineer Lazaro says parliamentarians must debate BBI with the open mind on the clause, allowing popular initiative. Our views can't be wished away, all right? And we'll see who else is there. Kiprono Abraham says BBI was never our priority. We have many issues to deal with and manage. Our economy is performing dismally. COVID-19 is killing Kenyans and our nation's unity is fluid. Why do we bring in something more divisive than it's uniting? Timothy Mudeki says, kindly ask Otiende Amolo to clarify to Kenyans how increasing the number of MPs, rewarding politicians with big seats in the expanded executive, among others, very expensive changes to the constitution will improve the normal Mwananchi living standards. All right, Jacob Abere says, I'm unhappy how our health institutions are handling COVID-19. Questions on numbers of ICU and HDU beds is alarming. Example like Machakos would have more than 100 beds, not 15, which have been used for political hula-baloo and conversations. I think the governor has explained that quite properly, that would be sufficient if the systems are not being overwhelmed by COVID-19. That's where we leave it for now. Up next is Jeff Koinange Live. He was speaking to Michael Joseph on the KQ Turbulence.